Good morning, everyone. Welcome, and thank you for joining us today. We're just going to wait 1 or 2 more minutes for some people to join. We'll start shortly. In the meantime, I would appreciate it if you could introduce ourselves in the chat. Just leave your name and where you're joining us from today. All right, I think we can start, and the rest of our colleagues will join us on the way. Good morning again, everyone. I'm Bokang Mpeta, Impact and Learning Specialist at Ilifa Labantwana, and I'll be facilitating today's discussion. It's my pleasure to welcome you today to the Early Childhood Systems Perspectives and Research webinar series. This is a joint initiative of Ilifa Labantwana, Research on Socioeconomic Policy, which is RESEP at Stellenbosch University, and Data Drive 2030. Our aim is to explore the latest perspectives and research on issues affecting the early childhood development service delivery ecosystem. And with this, to create change for children through the promotion of data and research. This morning, we'll be discussing a research brief which is titled The Affordability Crisis in Early Childhood Care and Education in South Africa. Some background to this brief. Quality early learning improves school readiness, long-term learning outcomes, and equity, especially for children from low-income communities. Yet more than half of children under 6 in South Africa are not in any early learning program. This gap is not incidental. And today we want to discuss the systemic forces behind the mass exclusion of young children from early learning opportunities. Our presenter this morning is Elizabeth Biney. Elizabeth Biney is a research specialist at Ilifa Labantwana. She holds a doctoral degree in labor law from the University of Cape Town. Her research interests include social protection, youth development, and population health. Before I hand over to Liz, some minor housekeeping. Please put your questions in the Q&A. We'll address these at the end of the presentation in our discussion. Or alternatively, you can raise your hand if you'd like to ask a question or make a comment during the discussion time. We'll also be sharing the link to today's brief, as well as links to previous webinars and many other resources on the topic of early childhood development. I'll now hand over to Elizabeth Biney.
Thank you, Bokang. Please let me know if you can see my screen once I start sharing.
We can see it. Just needs to go into full screen mode.
Yes. All right. Thank you. Thank you for having me. It feels a little bit strange to be on this other side of the equation today, but it's exciting as well to share some of our thinking and the ways we are trying to close some of the understanding in the sector. So this morning, we want to present some of the key insights from the research brief that we looked at in terms of the early childhood care and education affordability crisis. And we want to examine some of the key or the systemic drivers that is keeping a lot of young children out of early learning opportunities. So before I dive into it, when we use the term early childhood care and education, or ECCE, we are trying to create a more sort of a broader understanding because our audiences are both local and international. However, in the South African context, early learning programs, or ELPs, and early learning are used interchangeably to mean the same thing as early childhood care and education, just for our practitioners in the conversation this morning. So whenever I use the term, it's essentially means the same thing. All right, so we're going to go into some of the contextualization of what we mean by the affordability crisis. And thereafter, I will look at some of the cost drivers that underpins quality early learning provision in South Africa. Then we want to look at the sort of the theoretical framework that we looked at this situation from, and then I will conclude. As Bokang has indicated, this presentation is based on a research brief put together by the research department of Ilifa. However, the presentation is I'm responsible for it. So any errors is my responsibility. It does not reflect that of both authors. So with that, let's kick off. I like to start by introducing the conclusion or the takeaway message, just in case we lose someone along the way. So what I would like out of this discussion today is that understanding that there are a significant number of children who are priced out of early learning. Access to quality early childhood education, early childhood care and education, or early learning opportunities in South Africa is unaffordable. It's unaffordable purely because the sector operates on a fragile quasi-market model where we have private organizations and individuals primarily providing and delivering services. Although government has a role in the way the services are provided in terms of providing regulations and oversight, because the provision is mainly done by private individuals, we have a situation where quality ECC or quality early learning is operating as a privilege rather than a public good. And why do we say that? We say that because affordability has become a situation where what early learning, what families can afford or want from can afford to pay for what they want in terms of early learning opportunities what quality provision actually costs providers to be able to deliver, and the policy and funding financing environment within the South African context act in a way that essentially means that even the lowest cost programs are out of reach for many households and families. And this is because we have a society where a huge base of the child population live in poverty. So they live in households that earn below the threshold to be able to function effectively or meet basic needs. So below 1,417 Rand. We also note the social context broadly, that we have a huge income inequality in that we have high wealth individuals where they earn, about 55,000 Rand a month versus very poor households or low worth individuals who earn about 2,000. So the gap is quite wide. And if we are looking at this quasi-market model, essentially quality that as the quality early learning that builds critical cognitive and social foundations becomes a commodity. And it's a matter of who can pay for what and what quality, the quality they get is basically what they are paying for. So when we look at the data broadly, so looking at the current Thrive by 5 data, for instance, we get some interesting information about the current state of children in terms of their early learning and their developmental milestones. From our own research in terms of the early childhood review, we are seeing that a significant number of children under 6 are locked out of early learning opportunities. That means they are not attending any form of early learning program, be it creche, nursery, play groups, those structured environments that provides stimulation and prepares them for formal schooling along the line. In this 3.8 million, there are there's some nuances that we need to highlight. So it's not that they are locked out primarily because of affordability, although affordability plays a very big role in this exclusion. But if we look at the nuances, you see that in ages 3 to 5, the access gap is not so wide. There are a lot more children who are attending structured early learning programs. The issue or the access gap it's wider in the age group of 0 to 2, where the younger children are predominantly in more at home. I must highlight here that for the younger children, the 0 to 2-year-olds, the home environment can actually be the most appropriate context for them because they are very young. But what we are also trying to highlight here is that in the event that caregivers of 0 to 2-year-olds want to work or engage in economic activity, and therefore they need to be able to access early learning for their kids, then the affordability question or challenge comes into that conversation. So even among children who are accessing early learning opportunities or early learning programs, we see that there is a really big difference. So if we look at the chart on the right is showing the stark link between fees and outcomes, in that children in very high fee programs are twice as likely to thrive or meet developmental milestones. This gap is reflective of the differences in program quality, and also broader socioeconomic realities that children and centers find themselves. So even the 58% of enrolled children who are on track, it's not the quality or how the developmental progress differs based on how the quality of the programs that they are attending, and the quality of the programs they are attending or they have access to is also determined by the affordability for both families and the financial viability for providers to be able to offer that quality services to families. So essentially, affordability here is not solely about parental preferences. And affordability also dictates developmental outcomes. However, what I'm trying to highlight here is that quality has now become a commodity. So that is the premise from which we are trying to understand this situation and how best to close the gap towards the goal of universal access by 2030. And in doing so, we used a systems lens to understand this crisis that we are trying to showcase here, right? So the aim of this, so the module on the right is basically a systems framework that we have developed to try and understand the affordability challenges in early learning. And the aim is for us to then appropriately sort of highlight the social and ecological context within which early learning and children are embedded. So we want to understand this to help us explain why many children have very different experiences, even if they are of the same age, right? Or they are even in the same sort of program. Household constraints, we've highlighted, provider cost pressures, all feedback into limited access. And in that interplay, we see a broader structural concern where poverty, inequality, and high unemployment are interacting to reinforce a cycle where affordability is a persistent challenge, and by extension, excluding the most vulnerable children from accessing this very important public good. So let's then look at some of the cost drivers that underpin affordability, underpin early childhood services or provision, right? When we looked at the literature or the sources out there, and we tried to collate all of this into this reference document that we have, that we termed the research brief, we see that staff salaries tend to be a huge part of the operational cost for providers. So it can take up to half or even 70% of operational cost for providers. And this is actually concerning because even within the sector, we know that practitioners often earn below minimum wage. And yet we are seeing a situation where this is the biggest part of their operational cost or the line item in their books. Obviously, in terms qualities, early learning services also have a nutritional aspect to it, and that it provides a really important vital safety net for children, especially children from vulnerable households where food insecurity persists, right? So the cost of providing this balanced nutrition can exceed the 40% subsidy allocation that has been suggested, which then means that the cost to provide is increasing if we are adding up all of these components, right? infrastructure and facilities, so the physical environment, rentals, to be able to actually meet the structural demands to be able to register, all compounds add to the cost of provision in some way. Quality cannot be quality without the process aspect, which involves learning materials, and obviously linked to that is the staff salary, which requires, it covers practitioner training and qualification aspect. And there's also a regulatory sort of compliance cost that tends to be embedded in the cost of provision, because practitioners have to, or providers need to be able to register, and they need to be able to meet certain structural threshold to be able to function or to be able to run appropriately. So running a quality program is inherently expensive, right? From your salaries to your infrastructure upgrades to all the nutritional aspects that you need to be able to provide for the children. So these are the areas where we highlighted that it makes up the bulk of operational costs. Of course, it's not, the cost of provision is not limited to these aspects, but these are the main or the critical ones that we want to highlight in this conversation. And added to that is also where children live and where providers are located matters. And in that, what we are trying to highlight here is that because geography really acts as multipliers for multipliers of cost for both providers and households. For providers in urban areas, it is mainly in terms of high cost in rental or the physical spaces that they have, or to be able to meet the demand in the area. So availability in urban areas is not usually a problem, because that is the skew. Availability in the South African context is skewed in such a way that urban areas are well serviced as opposed to rural and informal areas. So for the informal and rural areas, which is essentially primarily where most low-income households or vulnerable families find themselves, this can be a huge problem for them in terms of availability, one. So because there are not enough early learning programs in these areas, the distance to the nearest area can actually add to transportation costs and also add to time poverty for caregivers who then have to travel and take their children to these programs. In terms of infrastructure, it affects low-income providers in that these areas also happen to lack the basic infrastructure services that the practitioners will need to meet to be able to register. So lack of basic water, sanitation, appropriate building or structure essentially blocks them from structural compliance for registration, which has implications for the financial viability and also their sustainability in the long run. And in the household conversation, because these areas tend to also be have high rates of unemployment, children we see a situation where there actually might not be high demand for formal early learning opportunities, because there might be an adult in the household or nearby that can take care of the children informally. While that arrangement might not necessarily offer stimulation and the cognitive preparedness for school, it's relieved some of the pressure off of families who cannot afford, either because they don't have enough household income or they are relying on social assistance to be able to meet certain needs. So these factors then combine to leave children who most need early learning services with the least access to it, essentially. So when we apply the systems lens, when we look at it from the framework that I showed you earlier, we want to see why it still remains unaffordable and inaccessible through that specific context or that framework. But before we go into that conversation, we need to also understand what the financing landscape looks like currently. So early learning financing is, as I said, indicated earlier, the system is a fragile quasi-market module, and it's based on the contribution of government, households, and philanthropic organizations, with households carrying the bulk of the responsibilities or shouldering the bulk of the financial burden. So government provides the early childhood ECD subsidy, which is currently at 24 Rand per child per day, up from the stagnant 17 Rand. But these subsidies, which is fewer than half of the 2.3 million eligible children that should ideally get it. And because of this, there is a situation where majority of the service providers are forced to charge fees to cover the shortfall, right? So when we look at government subsidies in the broader context, South Africa essentially spends only 0.15% of GDP on early learning. This is way below the 1.5 below the 1% international benchmark. So we spend 0.15% of our GDP. The ideal benchmark should be 1% of GDP. So this asymmetry means the burden falls on households. When we look at an example from the a cost analysis that was done in 2021, households essentially spend 5 times more than the government subsidy, right? So where a government subsidy was fixed, totaling around 2.8 million, households were spending around 14 million. So what that means is that if you cannot afford, you don't have a lot of disposable income, you cannot afford to access quality, or the amount of money you can afford will determine how much or what quality you can essentially get on the market currently. There are donor funding, but it is a really small proportion compared to what, compared to government subsidies or household fee payments. Perhaps it is also important to highlight here that this in the last financial year, 2025-26 budget, we saw a huge move in terms of government additional investment in early learning, with a 10 billion additional allocation, which then raised the total investment in early learning significantly from what we've been seeing in the past, 10 years, if you look at it that way. And this investment or additional allocation is also then means that the sector will be able to then target more children by 2028 and hopefully work its way slowly towards universal access with sustained investment, obviously. So while there's a significant progress in the financing landscape, a substantial funding gap still remains, and households continue to shoulder the heaviest burden. When we look at some of the cost of provision or estimates of cost of provision to see how much it truly costs to provide quality early learning, drawing on the work by Chemistry and Wales, we see that the cost of provision, there's a huge gap or funding shortfall in what it truly costs and what providers are getting or what government is contributing towards early learning. The most conservative estimate around there puts the minimum cost of provision around 36 Rand per child per day, which is still above the 24 Rand in the subsidy that we are seeing now, right? But when we look at on the right-hand side in this picture, when we look at what it costs for a basic care, so this one is like the average cost, like if we want to be extremely conservative in what centers or providers need to provide just the basic care, early learning and education, we see that it costs about 49 Rand. There's a huge gap of 25 Rand if we compare it to the government subsidy of 24 Rand. For a fully registered program, that cost rises to 55 Rand per day. And for a program that meets all the compliance standard, actually not even all, like significantly more, like 80% of the compliance standard, the prices shoots up to about 91 to 93 Rand a day. So there is a big gap in here. What this then means is that if we are looking at if you recall, some of the big line items in terms of cost of provision, 24 Rand per day is not sufficient to cover staff salary, nutrition, learning materials. And what that then means is that either providers will be forced to reduce the quality of their services quite substantially, or there is also this avenue where they will have to cover the gap in provision by charging fees, so passing it on to parents or households. And this then means that many low-income families will not be able to afford fees, right? Will not be able to access these services. So when we look at even programs who are subsidized or programs who are receiving the subsidy, they also have to be able to cover the full cost of provision for them or to even be viable. And the average fees charged per month there is about 208 Rand. That is, if we look at that in conjunction to the child support grant of 560 Rand, that is a huge sum or a huge proportion of those households' income. And so what we are saying is that because there isn't enough public investment, financial investment in these programs, providers are having to charge fees to be able to meet the shortfalls. And because we have a society where, if you remember the outer layer, there is high unemployment, we have huge income inequalities with the wealthiest being able to afford a lot more and the poorest not being able to meet even the basic needs. Any funding shortfall poses a huge challenge for low-income families and their children. Although perhaps it is worth mentioning here that some low-fee programs or low-income providers still allow children to attend or access their services despite their inability to pay or delays in payment. So there are arrangements that gets offered to low-income households to be able to make sure that access is, available for people as much as possible. But that also points to some financial vulnerability on the part of providers. So added to that is the regulatory environment, the policy and regulatory environment that actually tends to also exacerbate this affordability challenge. So regulations that are intended to protect children often also tend to be prohibitive and cost-wise, and then also impact access for children inadvertently. So I don't think it's intentional. It's just one of those things that it's an after effect. So we are seeing a compliance catch-22 in the sector, in where program needs funding to be able to achieve this compliance, the requirements for structural compliance to register. But in order to do that, they need compliance to qualify for that funding. And so it becomes a cyclical issue where if we even remove the low-income households, their situation aside about their limited resources, and we look at what it takes to be able to finance upgrades to meet the compliance, we are looking at huge sums of money, right? So the building plans have been estimated to cost somewhere between 6,000 to 10,000 rands. Land zoning has been estimated to cost somewhere between 15 to 20,000. And what this means is that for very low income providers who either charge no fees or do have most of their clientele coming from very low income households, these fees are extremely prohibitive and exorbitant. And so they will not be able to meet this compliance. And that compliance means without compliance, they do not have access to the government support that they need to be able to then improve their services, they improve quality. So the many barriers that we find in municipal bylaws and in the Children's Amendment Act, and in expectations for what is needed to be able to register, so the registration requirements, even when they register, there is also that issue of difficulties or administrative barriers in terms of subsidy administration. So some centers have experience delays, or they do not get the funding that they need on time or at all. We've seen the latest ruling on the KZN case, and that is a clear example of some of the administrative barriers or challenges. So without that, we see a loop where low-income providers that will be able to establish new centers in areas that are underserved are finding it difficult to enter into the formal regulatory net, or to be able to come into the spaces to be able to provide the services. And a very important aspect to highlight here is also the land ownership policy, where public funds cannot be used to upgrade centers, programs on private land, which essentially means affect most of providers, because we have providers who are either operating from their homes, they are operating from areas that are on private property, and that becomes a huge stumbling block. So what this means is that there's a circular trap, right? So programs need subsidies to meet standards, but the standards to get those subsidies, they need to meet standards to get those subsidies. And this systemic failure means that public resources are essentially flowing to primarily to those programs who are already in who have the capital to meet compliance, and therefore we are reinforcing or sustaining a two-tiered, highly unequal early learning system. So the graph on the left here essentially sort of summarizes some of the pathways that we have been talking about in terms of how cost and quality work to, and affordability work to impact access. Essentially, this, if we take a step back and we look at this situation outside of the child or the immediate individual, care systems are essential economic and structural social infrastructure, right? So the unaffordable child care situation we are highlighting here has wider social implications. So fixing this affordability issue is there's an economic imperative here, because systemic reform can unlock about 500,000 new jobs, primarily for women, because women are predominantly holding this sector steady. It can also drive or enable women's labor force participation. So childcare caregivers can then be relieved of their childcare responsibilities to a greater extent, so that they can have some of that time back to be able to engage in economic activity. And it has, in all of these, we'll be able to sort of bridge some of the gender inequality gender gaps we are seeing in the country, and be able to drive national development forward. So without this fixing or making an equitable early learning system, disadvantages are passed on from one generation to the next, and we have a situation where it's difficult to break the cycle of poverty and inequality. In conclusion, what we essentially are trying to highlight is that this is there's a multifaceted gear, if you will, in that you cannot fix one without consideration for the other, because if one remains locked, we cannot unlock the other ones. So we need to be able to solve the household income inequalities via expanded subsidies and possibly no-fee models. We need to bridge the gap between the subsidy and the true cost of provision, so that the provider cost pressures are addressed. And we also need to be able to overhaul the fragmented registration and the prohibitive structural norms that essentially makes really good, well-intended policy and or regulations slightly prohibitive for low-income providers. And we have, a lot has been going on, and a lot is happening, and a lot still needs to be done. So if we look at this sort of mind map of, or mapping out of where we started from in 2025 or even 2024 and where we are now, we have seen that there's a huge movement, or there are a lot of reforms that are happening now. And we have seen that with the 10 billion, the funding or the financing aspect is picking up to be able to meet the needs of providers in terms of what it costs to be able to provide quality early learning. And for households who cannot, who do not have the income to be able to buy market, pay the market price for early learning to be subsidized. And we are seeing a situation where the regulatory environment is also being attended to, with the current Children Amendment Bill being a clear example of where we are seeing a lot of progress to be able to make sure that the requirements to be able to meet legal compliance does not become a stumbling block for access. So momentum is building, it has been set, but what we are essentially saying is that for us to be able to achieve equitable, for the system to be equitable and to meet what it needs to do, we need coordinated coordinated action across government, civil society, across society as a whole. But here I want to leave that in trying to address the affordability crisis and designing the system to be more equitable, we also have to be mindful or have at the back of our minds the bigger or the broader social systemic challenges, which is the inequality, poverty, and unemployment. In short, what I'm trying to highlight here is that improving the ECC system is not only about what happens, how we improve what happens in the four walls of a program, but it's about supporting families, communities, and the conditions around children so that we are able to make sure that families have real choice to be able to access what they need for their children and for all children to be able to thrive. Thank you.
Thank you very much, Liz. Um, we do have one question that's already been posed in the chat, but I would just like to again encourage everyone to post your questions in the Q&A box, or since we are now within discussion time, you can also raise your hand and ask a question or make a comment that way. Okay, sorry, I'm having a bit of connectivity issues. All right, I would like to welcome the person who posted in the chat. I think the name is Nyarazo Motanya. Apologies if I'm mispronouncing that. Would you like to ask your question?
Hey, hi everyone. Also trying to figure out where to get the unmute button, but I found it luckily. Yeah, so my name is Nyaradzo. I'm a monitoring evaluation specialist. I'm from Bridland, Africa. And yeah, I think this is quite insightful because we also see, I think, in our space, what Bridland Africa does is that, we work in sort of like your disadvantaged communities. We provide infrastructure support to ECD centers. So I think outside of this, you guys can also, like, if you can also find me on LinkedIn so that we can speak further about the work that we do. But what the data has been telling us, what we have also been seeing is that, I agree with this report, ECD centers do really struggle with meeting infrastructure requirements, especially for them to get subsidies, sort of like a chicken and egg kind of like situation. But I just wanted to find out, and we do spend like a lot of money in providing classrooms and kitchens and everything else that they need. And obviously, we work with partners, that will come in maybe with teacher training support or food and nutrition in those kitchens, for the kids to eat. And because we know that if they are hungry, they can't really focus in class and stuff like that. But then in terms of just the percentage, I was just like keen on understanding because I think earlier on you showed, you know. The distribution in terms of like how much percentage is spent on I think human resources, but I would like to find out if maybe you've got like that in percentage form so that we know how much percentage is spent just on infrastructure, because from my understanding, I know that is the most expensive intervention that you need to have at an ECD center. Thank you.
Okay, thank you. So what we try to do is that we try to collate all the important sources and pieces of information into one document that then serves as a reference point for trying to understand this very complicated, it's very complex, this crisis we are trying to understand, right? So I might have maybe made this sound very simplistic, but it's not. So in terms of the cost drivers, I can't tell you exactly what percentage it is, but we are essentially trying to highlight that infrastructure, the costs of infrastructure, and to be able to meet that structural requirement for registration is quite exorbitant, especially for very low income households. very low income providers who do not have the capital to invest in this infrastructure upgrades, right? So some of the estimates that we saw up there, or even based on the DBE's own estimate in the 2030 strategy, an upgrade can cost as much as 330,000. Building a brand new building, purely purpose-built infrastructure, is around 700,000. I'm assuming these are very conservative estimates. So infrastructure expenditure is indeed a big component of this. I can't tell you for sure what percentage of the operational cost that involves. These are ideas for ongoing future work that we want to do to understand the true cost of provision in the sector itself as well. So we are thinking of undertaking that exercise. This might be a non-answer. I hope I've given you some sort of indication. I think we are all starting to truly grapple with the affordability conversation at the moment. My colleague Colin is also here. If he has a better view or idea, I welcome it. But also, I think it will also be interesting to hear from practitioners who are in the room what some of these cost drivers and challenges that we may have overlooked in our research that are real and substantive considerations for the sector to have in mind when we are doing the work of building.
Thank you, Liz. Before, there are two questions in the Q&A that I'm going to ask you to answer, but before we do that, I want to ask from your perspective. So obviously you've discussed a very complex problem, and in a way that you were trying to distill it and simplify it. But I'm curious to know from your perspective, where are the critical sort of leverage points? So, for example, this infrastructure issue is a major hurdle, and 700,000 rand is not something that can easily be solved even through the increased funding through subsidies. What are the other sort of key leverage points that you see within this crisis where you can have or where we rather as the ecosystem could have the most outsized immediate impact to solving this crisis? And then
Okay.
once you have answered that, then a follow-up to that would be Nicholas's question in the chat, which you can raise your hand, Nick, if you would like to elaborate. He asks, is your feeling that we are beginning to turn the tide on some of these interconnected challenges?
Yes, okay. So I think they're connected. So the sector is beginning to turn, things are happening that are moving the needle, except perhaps it's not going fast enough. we needed to have done it like yesterday, but let's not dwell on that yet. In terms of leverage, points to leverage and move the needle, I think the regulatory aspect and the funding, government funding interventions is important to sort of assist providers, low-cost providers, especially to come into the regulatory fold and to be able to meet the cost of provision truly. So I think while subsidies are not alone, it's not going to solve the problem. We need to be able to increase it to a certain level that providers will be able to then meet the cost of provision and provide quality services. The infrastructure support outside of registration is also becoming an important way to be able to make sure that programs do meet the compliance the structural compliance requirements to be able to register and to be so that parents are also have peace of mind that their children are being kept in a safe place and not necessarily going to a place where it can end in another story, right? So all those things that we are seeing, the movement we are seeing in the sector with the Banapele mass registration drive, with the amendment to the Children's Amendment Bill or Amendment Act, the increase in the in ECD subsidy, which needs to still increase some more, are all things that we need to sustain going forward. But the sector also, we cannot turn a blind eye. So I think it's important for us to also apply sociological imagination, if you will, in that what happens within the sector is impacted by what is happening within the broader society. So that broader ecological context matters. If we are building we are creating a system and trying to provide more early learning programs, but then the society is inundated with poverty and unemployment, and they cannot absorb those programs through demand, then it feels like we are not really solving the situation. And so that comes to the point that there needs to be coordinated action across government. It's not for the sector alone to think. We need to also bring in outsiders, labor, social development. Everybody needs to come on board to be able to play their role to address the broader systemic challenge, which takes longer and is a lot harder than increasing a subsidy, for instance.
Okay. Thank you for that. On that, we do have a question about the 10 billion that was recently allocated, the additional 10 billion that was allocated. And most of that is for subsidies. So the question is from Natalie. Natalie, would you like to ask your question out loud?
Yes, thanks, Bakang, and thanks, Liz, for the great presentation. My question is really around if you have any sight of how the 10 billion is spent beyond the subsidies. We know that is going to take off a big chunk of that. But is there any focus around how that is spent? Because if the 10 billion is not effectively and efficiently spent, of course, it won't unlock more government contributions. And of course, the fear is always that it gets, we don't get to utilize the full amount, and of course, Treasury will reduce that amount in outer years because of the spend pattern. So is anyone looking at that? And do you think it's worthwhile in terms of how it's spent currently? Thanks.
Okay. Thanks, Natalie. And yes, we have a economics and financing unit in Ilifa that deals primarily with that work. So I'm going to pretend to speak for them and say yes, they are all eyes on board. We are monitoring how that 10 billion is going to go through the chain in the 3 years that it is allocated for. My understanding is that the 10 billion is for over 3 years or 3 financial years, and it is a conditional grant in that it has a specific purpose, right? So it is meant for this subsidy increases and for it to increase the reach of children who are now getting financial support to be able to access early learning. There is a little bit of top up for infrastructure, but that aspect is, as I've highlighted, because of the current policy about not spending public finance on private land upgrades, it is quite difficult for that money to be channeled to the providers who need it the most to be able to meet the requirements for registration. But in terms of the actual subsidy, the subsidization for access, that aspect is being monitored closely, although we are because it was unexpected and it came at so quickly, the absorption rate is taking a bit of a challenge. So I think the sector is in a place where it needs to think about designing how to really absorb the money and to get it to where it is needed the most, which is the low income providers and low income families to be able to access quality. So in a nutshell, yes, we are monitoring it, and we will also share updates on our website and social media when we are done with that research. Thank you.
Thank you, Liz. I have one question, and it is around non-center-based programs and whether there's a reality around how ECCE is provided in low-income communities that we are not currently accounting for or fully understanding. But I do note that we are already a minute over time. And we have another question from Colleen in the chat. So what I'd like to do is I'll just read Colleen's question out loud. But I do want to dismiss formally those people who really need to go because it's already past time. And if it's okay, we'll just continue. For anyone who can stay for another 4 or 5 minutes, we'll continue for the last question. Is that fine? All right. Thank you to everyone who's joined. Please do join us again next month on the 5th of August, where we will be discussing the ELOM tool and answering the questions, do ELOM tools have predictive power? Okay. Liz, you can start with Colleen's question.
I don't think I caught the question. Sorry. What was
So
it?
Colleen asks, beyond the Banabili registration process that has been initiated by the DBE, is there a conversation happening within the department regarding the obvious solution of the establishment of department ECDs in rural
Oh,
and informal areas?
Okay. I do not speak for the government. I cannot speak for their plans. Sorry, Colleen, but I think, yeah, it's a no from me because I don't have inside information into their plans. But I think the best person to reach out to will be the DB themselves to hear what they have planned outside of the Banapele drive and also the shared blueprint that they are trying to use to sort of underpin the interventions that they are planning, they have in the pipeline to address some of these issues we've highlighted in today's conversation. So unfortunately, I can't speak for the DBE, and I don't have friends there to even give you the tea. Sorry.
Okay. Just before we close, there was one or two comments that I saw in the chat that I just wanted to read out loud. Toko made the comment earlier around a key area that is often overlooked in these discussions is maintenance costs for maintaining existing infrastructure. And then Nicholas just said that he agreed that it was a broader contextual challenge that cannot rely only on the DBE to solve. All right. And with that, I think that we must now close today's session. Thank you very much, Liz, for an incisive and very thought-provoking conversation that is challenging us to think more deeply about this issue and continue to thinking about it. And to everyone else who joined, thank you for your participation today, and we look forward to joining you again on the 5th of August.